All right, TikTok live number 36. We are on now. We are live. We're humming. We got a bunch of people on the live. The first question was asked, so I hit start. This is TikTok live number 36. I'm recording this. I'm going to put this out on YouTube, put this out on podcasts later so you can always listen back. And the top 3 listeners that stay on the longest, I give you guys a shout out in the caption of the YouTube and the podcast. Okay, so you're in there. You guys were in there last week. Yeah, so you'll be in there again this week. So that was awesome. All right, friends, let's get into it. Host VG25 said, what was your DAT score? Yeah, so my DAT score was a 21 academic average with a 22 PAT. The PAT is that perceptual abilities test. 21 was the average of a 24 on Orgo, a 22 on Gen Chem, I think like a 20 on bio, and then like a 19 on reading, and like an 18, 19 on math. So it all averaged out to about that 21 academic average. Noel joined, Billy Hoare joined, Kevin Rail joined, Mr. and Mrs. Wiggle joined. Wow, Mr. and Mrs. Wiggle? That's 2 wiggles. There's a lot of wiggling going on. Host VJ25, how did you study Chad's videos? You've cracked the DAT. Cracked the DAT PAT was excellent. I did that actually in my winter break of my final year of dental of undergrad. And then I took about a month and a half to study for the DAT after I graduated college. By getting the PAT out of the way, because as you know, the PAT, that perceptual abilities test, is the only part of the exam where you never learn that in college. Like there's no course on that part in college, right? And so you have to earn that. You have to learn that entirely on your own. Chad's videos are excellent for Gen Chem and Orgo. You have Crack the DAT, which is great for all the sections, especially the PAT portion. Obviously, boot camp. But guys, we got to keep this fair though. I haven't studied for the DAT. That was literally 8 years ago. Like I'm 8 years out of, I'm almost a decade out of it. So there's so many resources now. I also use the AP Bio book. So just things to keep in mind, all right? User 7356, how many interviews and acceptances did you have? OMS is the dream. For OMS or dental school? User 7356, are you asking for oral surgery residency or for dental school? I'll say quick for dental school. Dental school was, I applied to 5 schools, six schools. Stony Brook, which is where I went. Stony Brook, Buffalo, Toro, Rutgers, NYU, and Florida. Florida, they take like 90-something in-state, so I did not get an interview there, rightfully so, right? And then the other 5, I got interviews to, and I got accepted on December 1st, December 2nd, on the first day that they send out the acceptance letters and stuff. Austin Parker just gave the #1 gifter badge. Just got the #1 gifter badge. All right, Austin Parker. What's up? Did I miss any questions here? Wait, can someone just... Did you break up with your partner first year of dental school? Flower Power asks, did you break up with your partner first year? No, she broke up with me, actually. How did you know that, Flower Power? Flower Power, that's a funny, I like that. But how did you know that? Like, I didn't expect that. Caught me off guard. How did you study? That was asked. Okay, I'm coming up to Charles G. Keep it up, man. We all got to keep it up, right? We got to keep going, keep pushing. It's Sunday right now. So Sunday night, I'll be doing this for maybe like another 20, 30 minutes. And then I'll be posting it later on this week. User 7356, how many interviews and acceptances did you have? Yes, so you're saying OMS is the dream. Malik asked, ways to set yourself up for dental school as a freshman. I would get used to really understanding how you study best. For me, I found that out a little bit later. That was like second, third year of dental school using Quizlet and the premium version. Premium version, you can put the figures on with the Quizlet, and that was huge. I mean, repetitions, and I'm a very visual learner, so getting repetitions of the same, one unique either figure or an x-ray or a diagram or per card, so per concept, because then you remember the cards based on the figure when you're taking that exam. At least that's how it worked for me. So Quizlet with the figures, and try and make them like prior to the class. So when you're in the class and whatever you have in those presentations, the teacher's talking about stuff that isn't on the lecture, but talking about other stuff, they might be test questions, so I would include those. Host VG25 said, wow. All right. Fish 15 fries. Thoughts on Penn Dental? Dr. Mark Wolf is the dean there, and he's been the dean there for, I think, at least 7-8 years, right? He used to be at NYU. I actually shadowed him when he was the dean of NYU, and I shadowed him that summer right after I took the DAT. That's when I was shadowing him, which is awesome because it looked really good. I think I got a letter of recommendation from him, so that looked really good. And that was a good part, actually. So, but thoughts on Penn? I mean, I've heard a lot of good things. I've heard a lot of bad things, right? Every dental school has its ups and downs. I wouldn't know the ups and downs of Penn like I do at Stony Brook, you know what I mean? Or here, for that matter. But Penn is still good as far as placing into specialties because For whatever reason, specialties, they like to see students coming from Ivy League dental schools. All right. That's something to keep in mind. Austin Parker followed the live creator. Thank you, Austin Parker. Awesome. TEE said, how many OMFS interviews do you think you need to feel safe for matching? I mean, I know people that matched with one interview or 3 interviews. I had 14, 15. I ended up feeling really comfortable after I had about like 5, 6, 7 interviews. But then here's the thing. I know someone who had 18 interviews and matched into the 16th one, like 16, 17, 18, like had like 17 interviews and matched to the 16th one, the second to last one. So, you really never know. Good question, but you know what I mean? Like you just never know. VG25 said, do you think there are any chance of getting in with a 13 academic average? Wow. I don't know, man. Probably not. No said, hello from Huevos Grandes, Texas. Hola, mi friend. Well, you might not speak Spanish, but Huevos Grandes. Nice. Huevos Grandes. Big eggs, no? Because huevos is, right? Am I getting this mixed up? Because you have jueves, right? Thursday, and then huevos. Eggs, no? Can someone fill me in on this? Huevos Grandes is big eggs, right? Am I? God, I got to look that up after. Austin Parker sent a rose times 4. 4 roses. Austin, take it easy, man. Ask a question. Let's do this. Trehan_blend said, what do you think about the Stony Brook for undergrad? I'd like to apply there for dental after 2. Oh, yeah. I think it's the best college on Long Island. And many people have said that before I went there. And then for dental school, it's still a good dental school. It's a small school. You get more clinical attention with the faculty members. So you get a lot of teaching there, which is great. In addition to that, Stony Brook, in-state school, great tuition. And then 3, Stony Brook has a great history of matching their students into specialties. That's very important. You know what I mean? They really set you up for the opportunity to do what you want to do. That being said, some negatives of Stony Brook. There was a lot of corruption there several years ago. Another thing is Stony Brook. It's out there in the middle of nowhere. It's generally a commuter school, so everyone's gone on the weekends. You got to figure it out for yourself. You're generally studying a lot, right? So that's fine. Another thing with Stony Brook, I would say, is that when you have small classes like that, the culture of that class, the environment that you're studying in, they're either everyone really gets along, or and it could come down to leadership too. Sometimes not a lot of people get along, and that could really be tough on your 4 years through a very stressful time in your life. You're always going to remember certain things that you went through in dental school. It's like the equivalent taking 32 credits a semester. That's what they say, when you're on your application and interview trail. So just some things to consider. All right. Pre-dental. Luke, what's up, dude? Luke, pre-dental. You took your name out of there. I know you want to keep it discreet on your interview trail, but I'm proud of you, man. I am. Luke, pre-dental. UF took 9 out of state. Yeah, dude, 9 out of what, like 120? I got to look that up. If you guys can check it out on the Predent Mentor Map, that's actually a service that my buddy Sean and I, we created. We have all like the tuition, class sizes and stuff. If they only took 9 out of state, how many are in that class? I forget. PredentMentorMap.org. I'm not going to look right now because I want to keep going, get to everyone's question. But yeah, check that out. Justin, what are your thoughts on orthodontics? Orthodontics are great. It is really good. What do you want to know about it, though? It's a very clean profession. You're putting on brackets, you're bending wires. I like going to the ortho clinic on Thursdays during one of my oral surgery rotations. Every Thursday afternoon, I'm at the dental school's ortho clinic, and I got some friends there now. Dr. Lai is awesome. I don't know if anyone knows Dr. Lai on there, but he's a boss, and he's really fun to talk with. He's also got first of all, he owns a bank too, which is nuts. And then he's got a sweet watch collection. What was it, last week? 2 weeks ago, he had on a Patek Philippe. I think it's a 5726, I think that's, or 5526. And that's like $150,000 watch, which is nuts. It's like the paper thin, beautiful. It's got a moon phase on it. I don't know. I'm a big fan of watches, as you can say. I'll stop talking your ear off about it. But yeah, Dr. Lai, he's awesome, and he's been there for like 20-something years. Towels, thoughts on phosphodiester bonds? They're great. They're really great. Post VG25, do you think there are any chances of getting in with a 13 academic average? Honestly, I don't know. That we got to get that academic average up a bit. Menica J. Carrasco, I'm an RDH, dental school next, or different career path in medical. Dental is still a lot better than medical. It's getting very corporatized, and they're opening up dental schools, and it's becoming Here's another thing. I just put out a TikTok this week explaining how dental schools now in 2024, like the last 10 years, they're making more money off of the students and not off of patient care. And now this is a very important thing to talk about, because it's not about making money off of patients. That's not it. But the incentive should be to see more patients, to get more treatment, to get more care for patients that need it, right? But when you have insurance companies now that aren't even reimbursing treatments that already have been done, dentists are losing money, dental schools are losing money, dental schools still need to teach, right? But they're adding more didactics classes and less clinical. Didactics are like PowerPoints and stuff, lectures, and then clinic is like actually treating patients. Dentists need to treat patients. It's a hands-on profession. That needs to be more. So when the incentive starts to get reversed like this, insurance companies are primarily how patients get treatment done nowadays, unfortunately, right? And I say unfortunately because these insurance companies are not paying dental schools. They're not paying dentists. And the profession's losing for that. And so, yeah, the dental schools have switched because the incentive is to make more money off of the dental students because they could just increase their price every year and not necessarily make it a better atmosphere for learning dentistry. And it's frustrating for me because patients are the ones losing, number one. Number two, the providers are losing. So is dentistry getting better? You see what I'm saying? Is it? They're not learning as much during dental school. They're getting all their clinical training and residencies now. The requirements to graduate are getting lower and lower. What are we looking at 20, 30, 50 years from now? This is a very sad direction. Things need to be flipped, and I don't know how that's going to happen unless we band together as a profession, we get some leadership in the right advocacy groups and start to change things from the bottom up and make healthcare about patients once again. So that's just my little rant on the topic. So to answer your question, Domenica J. Carrasco, you're in RDH. You still have a lot of power in your hands as an RDH. I know you might not think it, but you could even open up your own clinic in some places and just be doing cleanings and hygiene and doing some really great care that people won't get in certain parts of the country, like ever, if you think about that, right? So career path different in medical, I would not do that unless you know exactly what you want to do and why you want to do it. Like you've been exposed to whatever that specialty or that area of a different side in medicine is, so that you're going to be excited doing it every day. Dental school, otherwise, like you're already a dental hygienist. What is the goal of what you want with your career, though? Is it because you want to do greater work? Is it because you think in your mind you could get paid more to do less work? It's not going to work out that way. You see what I mean? Figure out exactly what you want to do. Don't let numbers get involved or persuade you from doing that or convince you from doing that. The only thing that should convince you is your excitement to do the same thing every single day for potentially like 30 years. All right, so those are my thoughts. Towels said, "Are scrubs comfy?" Yeah, they're super comfy, dude. They're like pajamas. Are you kidding me? I'll wear these any day of the week. I'm not putting on. I mean, I do like the look and to be professional, shirt, tie, suit, maybe, but the scrubs are super quick. I'm not wasting time tying up my tie again like I did every day in high school. No, let's get to work. Let's talk. Let's make a podcast. Let's answer questions. Let's help the future generation. I don't know, that's my thought process. Mark96 followed the live creator. Thank you, friend. Yeah, I'm sorry, guys. You got the sirens in the back. I live across the street from the 3 hospitals I work at. User 7359. What was your GPA? My GPA in undergrad was an average of a 3.6. I started at a 3.4 at NYU Polytechnic Institute. That's the engineering school, Tandon School of Engineering of NYU. And in the latter 2 years, I transferred to Stevens Institute of Technology, right across the Hudson River there in Hoboken, New Jersey. And I got a 3.8 from there. So it averaged to about a 3.6. Tenzin, yo, what's up? What's up, Tenzin? Tenzin said, towels, yes, I prefer hospital scrubs when shadowing. Well, yeah, when shadowing, observing, especially in oral surgery, you have to wear hospital scrubs, right? If you're going to go to the OR, you need to get the hospital scrubs that you're working at. For in a clinic or day-to-day, I would prefer like these. I don't have a sponsorship so I'm not going to say the names because these, like, dude, I just found out like Figs is spending all this publicity to get. They're like the original Scrubs brand, right? They did the most marketing, and now they won big, and then they signed up all the good-looking influencer, like people with Instagram accounts on Instagram, and now what they're doing is they're flying out these people in dental school to make it basically free publicity stunts. They're flying them out and paying for it, and then they're flying them back, giving them like a free pair of scrubs, but they're not paying them, which is like, I don't know. Dental students are falling for it big. That's all I'm saying. Host VG25. Any tips on how to improve data score? The DAT score? Yeah, studying. You got to study more, and you got to learn how you study best. I've talked about this multiple times. Efficient and effective studying. Effective studying is going from an 80, 85, 90, B, A plus. That's effective studying. It means that you're learning the material and you're doing better on exams. Efficient studying is now say you're a 95. Well, let's keep an A, but get those 6 hours of studying down to 5, down to 4, down to 3. If you could study going from 6 hours to 3 hours and still maintain like a 95, you're crushing it. And that's how I want you to get into prior to getting into dental school, because you're going to see, it's like 32 credits a semester. Like I said, you're not going to have many times. Some days you're going to have 3 tests to take. You're going to need to learn how to study effectively, but efficiently too. Anthony said, have you heard of certain toothpaste causing discoloration in the skin pigment around the mouth? I mean, no. I mean, maybe you're using like bleaching agents, or you're trying to do the whole charcoal thing, which shouldn't even really do it, but that's a very abrasive. You're just taking down layers of enamel at that point. No. I mean, certain toothpaste, no. Maybe the whitening, no. Smiley face said, best school in New York. Oh, that's tough. And it's pretty subjective, because you could say clinically, which is the best one. I would definitely say Stony Brook. The best culture in New York, I would go with Buffalo. Everyone that goes to Buffalo Dental School, like, it's cold. They kind of, bitch and moan about the weather up there on some occasions. But generally, they're all pretty happy with the dental school. Generally. Not everyone, generally. But you could also say Columbia. It's pass-fail. There's very little stress when you're at a pass-fail school, right? You're doing it to learn, and maybe that pass-fail is higher than like a C. But when it's pass-fail, that takes some stress out of the equation. You know what I mean? So, you know what I mean? Like, and then you could say tuition too. That would be Stony Brook or Buffalo. So there's so many ways you can. You got to be more specific on how I would recommend what the best school in New York would be. Till EDK, thoughts on Texas A&M in Dallas? Yeah, Texas A&M is a good dental school. I know a lot of students from there. Good school. Rochelle said hello with a smiley face. Hey, Rochelle. Sarah said, do you think we'll ever be able to influence the growth of jaws without surgery in the future? Yeah, without surgery, though, it'll be tough, but you could use, like, conservative methods, like non-invasive treatments, maybe like certain mouth guards over time. There's going to be different ways using, new advancements in ergonomics. Yeah, there's going to be a way to do it. Patty Gucci said, how do you work so much and still have energy? Well, Patty, I mean, you got to find what you need to find what makes you most excited and what you're most passionate about. I like to connect with people. I like to help others, and without needing anything in return. I mean, we're recording this. I'm making content right now. And I feel like we have really productive conversations on here. I get asked questions. I answer them. Some people find it very helpful. I like doing that. I want to help out, And one day, I think, maybe through this, we're developing a podcast community, or connections. I've made a lot of connections through social media, and I really think those connections together, if we come together with similar ideas, there are certain things in dentistry, for example, that could be so much better. And maybe by coming together as a profession, we can actually make them better for a brighter future. Because otherwise, it's very hard to make anything happen, right? If you know no one, and if you're only working for yourself every single day of your life, you're probably not going to get too far. That's just, how do you work so much and still have energy? Because, like, I don't know. This is awesome. This is exciting. I like this. And yeah, you have to work. I've been on call all weekend, second call. So I'm not running into the hospital. Second call is I take phone calls. And today's a very light day. Yesterday was facial trauma. So yesterday and last night was the heavy day for call. And then I have 5 more days on second call this week at the busy hospital. So that's why I'm getting the TikTok live out of the way now. And then I'll post it either tomorrow or Tuesday. But because I have time now. It's the weekend. I'm on the busy hospital rotation right now, and I'm not gonna have time to connect with you guys during the week. George says, what were your stats applying to dental school? 3.6 GPA. I had 21 DAT academic average and a 22 PAT. I did research in undergrad. I got a research award somehow, and I played basketball for 3 years of college, and then transferred, played 1 more year, and it just didn't feel good, didn't feel right. So I stopped. Observed doctors, dentists, and found my path to here. Yu-Gi-Oh! 1500 NYC. Hey, bro, I don't be seeing you popping bottles or drinking champagne. Are you okay? Dude, you let me know when you're around and you got the bottles and the champagne. You let me know, okay? And we pop them. Mari said, is research important for pre-dental student? If yes, is it important to do research in dentistry field? Look, like it's not the students applying to dental school these days have all the stats in the world. So it helps if you also have research or have a research award or whatever it may be. And that could be important. It's not necessary though. You can make a great argument that there are other elements on your application that are so much more important. Leland, is UPenn good for OMFS? UPenn is generally good. Wait, UPenn Dental School for getting into OMFS, or the OMFS program at UPenn? Is it good? It's generally good, but there are better out there. It's true. One of my buddies here is from UPenn, and he ranked here number 1. So did I. He did not rank UPenn number 1. So I don't know. That I consider that much more highly than what I know. You know what I mean? He went there. He was there. Mary said question mark. I just answered up there. KB said, how well do you do in the ICU? How well or how will you do in the ICU as DDS? Yeah, well, I mean, I don't know. It's a great question, but we did it. You just kind of have to suck it up. You got to learn what you need to learn. You need to take care of patients just like we do every day, whether it's dentistry or medicine, because we're the only residents that end up in the ICU. No, periodontics, general dentistry, pediatrics, they're not in the ICU. But we do a rotation through that. The MICU, that's the medicine ICU. That was brutal. And then SICU, that's the surgical ICU. That was a good rotation. That was pretty chill. I like that one a lot. I like the SICU. That's the surgical ICU a lot better. Trent, should I shift from pre-med to pre-dent? Well, that's up to you. Have you shadowed dentists? Have you seen what they do for a living? I would look into that, and that's really important. Jefferson S. Raskin, hey, Doc, you graduated? 9 months, brother. 9 months, and then we're out and about, and we're getting after it. Kai, you said, what do you think about non-cat year for OMFS? If you don't have to do it, don't. If you have a really good CBSE score and you don't match into an oral surgery program, I would do a non-cat at the best program you think you can do a non-cat at. Earn your sunsets. Do you learn ACLS as a dentist? No, you do not learn ACLS as a dentist, but you do learn it as an oral surgery resident. And you need to do the ACLS course ACLS or ATLS? Which one are you talking about? You have to do it every 2 years. You have to read, I think, well, that's ATLS. I'm not sure what ACLS you're talking about. I think you meant ATLS, right? The trauma life support, advanced trauma life support. That's advanced, or you're saying advanced cardiac life support? S said, I would like to ask about OMFS residency in USA. Sure. What would you like to ask about OMFS residency in the USA? Vadim 102572 said, Brendan, you are the best. No. I appreciate it, but what question? What can I help with? Sarah, is it bad if I whiten my teeth once a year? So in oral surgery, we don't generally whiten teeth. We don't do any teeth whitening. That's a cosmetic or general dentistry procedure, if you will. That's treatment you get in a general dentist's office. I would ask your general dentist provider what they think about it, okay? I can't get whitening. My teeth are so sensitive. I put one of those advanced whiteners on. Literally within 5 seconds, it felt like electric shock went through. I also have gingival recession. I think I brushed too hard when I was a kid. Now I use the electric toothbrush because it turns red whenever you brush too hard, which I think is helpful because I learned, oh shoot, I'm brushing way too hard. The harder you brush does not necessarily mean you're cleaning your teeth more, making them whiter, which I learned later on in life. User said, I got a composite filling last week and I've tasted metal ever since. What's going on? Composite filling, and you're tasting metal. That's a good question. Composite is not amalgam, right? The amalgam is the metal filling, if that's what you're trying to think about. A composite? I don't know. Maybe around your tooth, they put a rubber dam and a rubber dam clamp down a little too far around the tooth, and it hurt your gingiva and cut it. I don't know, but last week, that's probably too many days for that. I'm not sure. I'm not sure what that could be. A metallic taste is generally like you're tasting blood, but I don't know if that is what's happening in your case. Prad, P-R-A-D, said, how do you know which dental schools are pass-fail? That's a good question. You got to look it up. Like Columbia is, Harvard is. I'm not sure. I think UCLA is. I'm not entirely sure. That's on the other side of the U.S. I've never even been to California, so what do I know? But most information you could get on all the dental schools in the United States, and we're starting it on Canada as well, is the Predent Mentor Map at predentmentormap.org. predentmentormap.org. Check it out there. We don't have the pass-fail schools on it, but you can ask students. We have a match system where you can ask current dental students at that school, and there you go. You can ask them if it's pass-fail. Kells Han, how can you be a good leader as a dentist? Well, generally, you are the leader in the office. You might be an associate dentist, but you're the leader of the team. You're treating the patients directly, and you need to be able to coordinate and communicate effectively with your staff, your team. They call them staff in the office. I like to call it a team because we're all very crucial and have an important role in treating every single patient that walks through that door, even if the dentist doesn't see them. You ever think about that? So how do you be a leader? I think you just need to care about your team. And for me, it comes down to I'm not going to call them my staff. I'm going to call them my team. And to be a part of my team, I consider that very highly. And I hope that others would too. I'm going to ask them, how can I help others out? I always do. People at the front desk, they're your first line of defense or even welcome, if you will, depending on how you look at it. And perspective is very important at every aspect of life even. But whether it's the front desk or all the way in the back, I always ask them, hey, is there anything I can help you with? Sandra, can I help you get anything? You know what I mean? Like all the way back to Stacy, is there anything I can help you with? Do you want me to go set up that chair while you need to go run and do that? You're no better than anyone else. Sure, your role in the dental office or clinic might be different at different times of the day or the year, but coordinating with the team and communicating effectively is I think how you can prove to be a good leader, and it all starts with intention, right? Nicole, thoughts on Rutgers Dental School? Great dental school, can be sometimes a little malignant and harsh at times, meaning the culture can be everyone out for themselves, I've heard. But generally, Rutgers is a good dental school. Yeah. C-Town, hi. Thoughts on UMich Dental School and their OMFS match rates? I'm not familiar with their OMFS match rates. And guys, if you can DM me on Instagram, get me in touch with, please help me so I can help you. Get me in touch with some ASDA groups at these dental schools, like University of Michigan, because I want to ask them what those match rates are, and then we're going to put them on the pre-dent mentor map. We can get them on all about 75 or so dental schools in the United States, and then we could start to tally up and record historically each year after year what the match rates are in from dental school into specialties. That's going to be really helpful. That doesn't exist right now. And on the pre-dent mentor map, we can compile that in an organized fashion to make sure that pre-dental students have all this information. All right. So Nicole, if you could help me, C-Town, if you could help me do that, we'll be able to do that. Okay. KKKKK5. How was undergrad for you? It was all right. You know, I liked being a part of the basketball team. And then I transferred, and basketball, I did not like being on that team. So I didn't do it my senior year of college. And I worked on research. I worked on my grades. I got a 4.0 my fall year. The first semester I wasn't on the basketball team. And it went well. Yep. Yeah. Actually, Stevens was a lot more enjoyable when I was off that basketball team, I got to say. West Coast, $, no insurance. My teeth are bad. What do I do? Well, I would start with going to the dentist. I would look up on Google, best, dentists in my area, and look at the top rated ones on Yelp and Google and compare and go there for a consult. ME6557, I have impacted wisdom teeth with cavities, but my dental insurance is out of state. I'm away at school. Any advice? Yeah, that's tough. You have to go in though. For your wisdom teeth, you could wait. I would generally at least get a consultation, get that x-ray. It's not easy, but I mean, you have to save up and get and pay for that consultation. I don't know any other way to say it. You know, it's like if your iPhone dropped in the toilet today and doesn't work, you're going to wait a week? You're going to wait a month? I don't think so. And I can guarantee you that iPhone's worth a lot more than a consultation at an oral surgeon's office or a dentist's office for that matter, right? To put things into perspective, Robbie, I'm wanted. By the way, you only have a finite number of teeth in your life, but you could always buy another iPhone. Domenica Carrasco, what made you choose dental? Better quality of life than medical. Once you shadow enough doctors and you shadow enough dentists, you get to see fairly quickly that dentists have a better quality of life and lifestyle, especially the outpatient offices, than in general doctors do. Said, do you like what you do, and is it worth the debt? Well, to be fair, I was very fortunate to not have debt. And do I like what I do? I do like what I do, but I like surgery, and then everything else that I do is not surgery, which is like 80% of residency right now. It's been ridiculous. The amount of non-surgery things you do in a surgery residency, which is very frustrating. How about this? Let me graduate. I graduated about 8 months now in June of 2025. We're getting there. It's been almost 3.5 years, so we're getting there. But after that, let me work a little bit, and then I'll get back to you and tell you if it's worth it. Okay? Fair? Leland, getting into OMFS. What about it? West Coast $, followed the live creator. Oh, sweet. Thanks, West Coast $. Dez said, I let him extract my wisdom teeth. Matt Mustard said, what is a good CBSE score? Generally, 70 to 75 or higher is a good CBSE score. If you get lower than that, that doesn't mean you can't get into an oral surgery program. I would work on externships at that point. L said, because no one wants to stay in Philly, with a laugh emoji. I don't know about that. GM, I have a CLV restoration practical. Oh, 5, yeah. Class 5 restoration practical. Well, good luck, GM. You got this. Class 5 wasn't too bad. Come on, you just put that little smiley face looking thing around the cervical margin of the tooth. KKKKK56 said, what's OMFS? OMFS is oral and maxillofacial surgery. Nathan Alicia said, D1 right now, loving it, but also crazy adjustment. Yeah, dude, it's a crazy adjustment, Nathan. The biggest thing, like I said before, is effective and efficient studying. I'm recording this for the podcast and YouTube, by the way. You could check. Top 3 listeners that stay on the longest, I give you guys a shout out in the caption just to point that out. But yeah, you can go back and listen to the efficient and effective studying that I recommend and how to do it. My recommendation is Quizlet. That's how I worked on it. But yeah, the adjustment's crazy. And then changing around your schedule, your routine, not seeing friends or family for weeks. David, is a GPR worth it for GP? I think so. as dental schools go on, I was talking about this before, the clinical experience is getting less and less. They are lowering the requirements that you need to graduate. Requirements as in clinical requirements, like how many dentures you need to make, how many patients you need to see, how many teeth you need to remove, how many crowns you need to prep. They're putting the clinical experience, delaying it onto residency, and then they could just have more dental students and charge more money, because that's the incentive as far as the healthcare industry goes right now. It's about getting more students in your classes rather than treating more patients. It's not right. We need some people who can advocate for the professions and change this, but that's where we're at right now. Jefferson is asking, do you think you'd want to stay on as an attending or private practice? I will not want to be an attending, and I already am signed for private practice. The attending life is working in a hospital setting. Not a fan of it. I am not a fan of it. The quality of life is just like, you mean nothing to these hospitals. Like, it's so crazy because these hospitals are having such a hard time finding providers and surgeons and certain doctors in certain areas, specifically in dentistry, like oral surgery. But yet they won't pay what you won't pay what someone's worth. You know, the training, the skill. I don't know. It baffles me. Max said, "Why are implants so expensive?" You know why? Because, well, there's a couple things. Implants are expensive because they replace teeth, and people want to get their teeth replaced. And then it's an invasive surgery, so that's number two. It can be minimally invasive at time, but it's below the gum line, and you're gonna bleed. That's invasive. And then number three, the insurance plans aren't reimbursing anything else that much, and in fact they decreased it around 2010, give or take a few years. So while costs and everything between the education, running a dentist office, materials, everything goes up and up and up over time, the reimbursement for that has been going down. How does this pan out? So the things that aren't covered by dental insurance, where do you think they're going to go? They're going to go way up. They're going to get very expensive. As that you need to run a practice. Here's where it gets scary, though. The things not covered by insurance are generally the more difficult things to do. You need more training. And now dentists are pushing to do these things, such as placing implants, doing big implant cases where you can make a decent living and make a lot of money. But they're causing a lot of problems to patients. They don't know how to manage those complications that the specialists know how to manage. And unfortunately, it's putting patients in harm's way. The insurance problem, the insurance issue is causing a lot of problems across the board in healthcare. And you know what? At the end of the day, insurance was created to get more people care, and less people than ever before are actually getting care. I can tell you that right now. It's insane. But you have to look at incentives. And everyone just wants to look at little band-aids and wants to fix little problems today, rather than looking at the long-term effects and outcomes of incentives. Leia said, what is maxillofacial surgery? It's surgery of the face, includes trauma. We do orthognathic surgery, which is cutting the jaws and then moving them forward, up, down, changing the cant a little bit, putting the midline centered, stuff like that. Maxillofacial trauma. So all the facial bones, when they're fractured, they're displaced fractures, or worse, they need reconstruction, repair. We do that. It can be anything, the bones around the eyes, the nose, back towards the ears, the TMJ joints. TMJs, things like that, and more. I'm just scratching the surface. Sarah, how many years do you think we'll be able to move jaws without surgery or less invasive? I think it's coming. I think it's coming in the future. Vincent, what do you love about OMFS? I love doing surgery, and I love oral surgery. I really do. And you know what? I'm enjoying doing trauma. I do. I enjoy doing oral and maxillofacial trauma. Peachy __0000. Can you tell me a joke? All right. I'll think of a joke, not the 2:30 joke, the dentist joke. I'll have to think of a joke. Leia, what dental school did you go to? I went to Stony Brook Dental School. Followed the live creator. Thanks, up. Sabri said, did you always know you loved dentistry? I did not. I didn't know I always loved dentistry, but I loved my mentors who were dentists, and one of them was an oral surgeon, and that's how this whole thing. I met them at the gym. I used to go to the gym literally every day, sometimes twice a day. Dr. Miguel, hold up. How no debt? I'm $300K in debt as a 2022 grad. Yeah, actually, 2022 was the year at which more than 50% of dental students graduate with more than $250,000 of debt. That's $250,000 of debt. More than 50% of dental students after 2022. That's insane. That's an insane number. Look it up on ChatGPT. It'll tell you. Official running egg yolk. How do you come up with these names? How many dental schools should I apply to? As many as you'd be willing to go to. As literally all of them. But would you be willing to go to Oklahoma or California or Utah or University of New England on the East Coast, Florida? Carrie, why dentistry over medicine? Better quality of life. Better quality of life. And oral surgery, that's why. No oral surgery from the medicine side. C-Town, when you were in the interview trail for OMFS, what were some dental schools more represented? If so, which? Harvard, Columbia, UPenn, Stony Brook, UConn, Florida, UCLA, University of Michigan. How's that? Did I name a few? Was that all right? Those are the ones I remember more prominently. I feel like I'm missing one. I'm missing one that's important. I said Harvard already. Forgetting one. Those are the main ones. Carrie, why dentistry? I said that. C-Town. Mo, what is your favorite surgical procedure? I mean, big implant cases. I really enjoy big major implant cases. All on X, guided surgery can be fun. I do prefer all on X like freehand, and I like to plan it in the DTX program before. Jefferson S. Graskin, dental insurance should work more like med insurance. Dental problems lead to medical problems. No, medical insurance, especially like the Medicaid and stuff, they're not even reimbursing family like internal medicine or family medicine treatments. No, I completely, Jefferson, you got to look into this a little more. And I'm telling you from my experience, witnessing it firsthand, dental insurance, look, we need a whole revamp, like the insurance companies need to stay private. We should not have public insurance. They need to stay private, and there needs to be competition. Because they do whatever they want. They don't even reimburse patients for the care that was given. It screws over patients. It screws over the provider. And then the future of dentistry just gets more and more expensive because they can't afford to keep an office open. This is what's going on, okay? I know it seems like, it should be all under one umbrella. No, it shouldn't. The more you corporatize everything and put it under the government, look at the DMV. Imagine having a dentist office, and this is what we're getting to now. This is the hilarious part. Everyone wants to, let's just put it all over one umbrella and it's so much easier. It's not. It is not. You need to look at incentives. And oh my God, imagine every single dentist office being run like the DMV. That's what it's going to come to. And you know what else? The less doctors make. Look, doctors don't go into for making money. They go in to treat patients. But the less money they make, the less incentive you have for the smartest people, the most talented people with their hands to actually do those surgery, to actually treat those patients. You want the smartest, most talented people with their hands doing the surgery on your heart, on your brain, on your cancer, so that it never comes back. Don't you? We need to incentivize it, though. That is not the direction we're going in right now. All right, guys, I'm going to wrap it up soon. I'll pick just a couple. Casey 1942, you demand. Thanks, friend. Do you think dentistry is still worth it, especially the cost? It is, but we're getting in a very gray area, and I wish we need to take the reins back a little bit. Jefferson is asking, can you do orthognathic as a DDS or do you need an MD? Yes, you can do it as a DDS, but not as a general dentist. You need to be an oral surgeon. For example, I'm finishing up my residency in 9 months. I did not do the MD track. It's a 4-year instead of 6 years. The extra 2 years in the 6-year track is for the MD. I did the 4-year track because we do the same oral surgery, we get the same salary, we get the same contracts, we could do the same work as the oral surgeons with the MD. Makes sense, right? Why would I waste 2 more years? Thoughts on DSOs? You could probably pick up. Anna, last question. What's up, Anna? What is something you did for your application that you think made you an attractive candidate? Well, here's something that Gary Vaynerchuk, if you know of him, talks about. It's self-awareness. And self-awareness goes from everything to maximizing your test scores by being self-aware how you study best, all the way to understanding what your strengths and weaknesses are on that interview. You want to go all in on those strengths, and you want to be able to communicate that really well to the interviewer. So things that I knew what was good on my application, and I went in on those. I know what I'm passionate about, and obviously, I'm sure you could tell. I'll talk your ear off about things I'm passionate about all day long. I'm also very self-aware that deep down, my intention is I have good intention. I want to do this for other people. I want to do the right thing, and I want to. My ultimate goal, if I could leave with one quote, is I want to leave the room better than when I walked into it, right? Just in general, right? Not literally rooms, but like certain things, situations, this life maybe. And hopefully one day I could look back, and maybe you feel this way too. Maybe we could all look back one day and say, it was worth it. I gave my all, and looking at where I came from to what it is now, things did get better, and that's something I could die being satisfied with. All right, friends, signing off. Good night. TikTok Live number 36. The top 3 people who were on the TikTok Live number 36, the longest, it's going to show me in the results on the TikTok Live analysis. And I'm going to give you guys a shout out in the caption of the YouTube, the podcast captions. You'll see. I'll put it out either tomorrow or Tuesday. And thanks, guys, for coming on. Thanks so much for coming on. And I'll see you either next weekend or in 2 weeks. I'm on the busy rotation right now, so I get to these when I can. But thanks again for coming on. I hope you enjoyed the talk, and I enjoyed having fun with you. Thanks for asking questions. We will catch up soon. All right, friends. Love you guys.